Hello, Doc.
Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Hello, Doc. Hello, Doc.
Hello, Doc.
Good afternoon, Doc, and you're welcome.
Good afternoon.
Yeah, how has your day been so far?
Very good, by God's grace.
Very good.
Yeah.
Thank you. Okay, so this afternoon we want to look at childhood cancers. It's something that I got to know about it through a lady who used to come to where I used to work. So she had a daughter who passed through this childhood cancer. So she started a foundation, and then she's been trying to educate people about childhood cancers, especially in Cape Coast. So I like the fact that today we're going to have this conversation. So we're going to throw more light on this issue. So let's just start off with the basics. What exactly is the childhood cancer, and then how does it So what exactly is when we talk about childhood cancers, what are they, and then how common is it in Ghana?
Okay. Childhood cancers. Well, we know what cancers are. Is abnormally fast-growing, multiplying cells. Okay, in the body, and then causing more harm by the rate at which they are growing, and then taking up the nutrients that should be actually going to your normal functioning cells. So it's when it happens in children. We have what we call the true childhood ones, which are those less than age 14. Then from 15 to about 19 years, we have the adolescent cancers. But we usually just group them all together as the childhood cancers in general. And they are actually quite rare. They are not that common. But why they are important is that they are usually very fast growing, and they are usually treatable if you are able to identify them early enough. You can quickly treat them. There's a higher chance of survival than in adult cancers.
Okay. Are they fast growing because they are children, and then, because they are in the developmental stage? Is that what makes it fast growing?
One of the major reasons, yes. Not the only reason, but one of the
major reasons.
Yeah.
Okay. So I want to look at the types. I know you've mentioned is generally cancers that are occurring in children, but are there any specific cancers that usually affect children, or any other type of cancers?
Okay. So usually, what usually happens with children, we have three groups of cancers that affect children mostly. We have the blood cancers, that's the leukemia, lymphomas. Then we have the solid tumors or solid mass cancers.
Okay.
So those are where you have the osteosarcoma, that's the tumors in the bone, in the muscle, in the kidney, in the eye. Those are the solid tumors. And then we have the brain, and then the spinal cord tumors as well.
Okay.
Those are more rare, and they tend to occur in the very younger ones.
Okay.
Yeah, so those are generally the types of...
So which ones are the most common ones?
The most common, I would say, are the blood cancers. More often the leukemias and lymphomas. We have the commonest one in our area is the Burkitt's lymphoma. So you have the child with the jaw swelling and abdominal swelling.
Yes.
And all that. So with them, they will come to the hospital, and then the parents tell you that, this huge swelling just started last week, and you'll be surprised.
How did it start last week?
How did this huge thing just start a week ago? But they are very, very fast growing. Yeah, and once you're able to pick them up early and start treatments early enough, you can save a lot of lives.
Okay. So what exactly causes this cancers in children?
Okay, so with the childhood cancers, unlike the adult that's usually associated with lifestyle, alcohol, smoking, these ones, they are usually associated with things that go on at the genetic level.
So it's genetic?
Yes. Not necessarily inherited, but it's at the genetic level.
During the meiosis and those things, when the crossing doesn't happen too well.
So it happens at that, should I say, cellular level.
Okay.
So when there are some abnormalities and things don't go right at that level, most often during the in vitro developmental stages, that's when you see the beginnings of these differences at the cellular level.
Okay.
But sometimes too, they are not born with it, but they grow up. Sometimes too, they have these syndromes Well, you wouldn't know Noonan syndrome. That was one of the first things I saw in medical school in the pediatric. They gave birth and they were like, oh, this baby is Noonan syndrome, and you realize that there were a lot of different things associated with
what is the Noonan, by the way?
It's a genetic condition, and it's different conditions including cancer and then some other structural abnormalities with the baby.
So are you saying that when the baby is born, maybe due to certain physical defects, you can tell that there's a cancer?
Yes, there's high likelihood the child will have a cancer.
Oh, okay.
Yeah.
Okay. And what are some of the physical defects that you can look at and tell that this child might have?
I don't want to say because it might cause a lot of unnecessary panic. Or someone will see some small, hey, my child's eyes are looking this way, maybe he has cancer. No.
Okay, so what would indicate that this child has a cancer? Okay, and then after that indication, what do you go through? That is the diagnosis process to totally determine that indeed this is a cancer.
So usually the beginning stages of cancers looks like any other common illness in the children. The headache, fever, vomiting, and all that. But the difference is that in these cases, the children don't improve with treatment. So the child has a fever, you treat for malaria, you treat
and
for
it's still not working.
Every sort of infection, they are still having the fever. The child is still persistently complaining of headaches, complaining of stomach ache, or the child is not growing at the rate he should be growing, or there's weight loss that you can't really explain. Sometimes they keep having vomiting or nausea, and then of course, you see the masses and the lumps which are fast growing. So if you are having your child, you are not supposed to be able to feel any of the internal organs by pressing on the child's abdomen. So once you are pressing the abdomen and you are feeling a mass, then it is not normal. You have to get to the hospital and get it checked out. Sometimes they get infections very easily. Small time they have an infection, small time they have an infection. Sometimes they bruise easily, they bleed a lot. Sometimes with the retinoblastoma, with the eye tumors, sometimes soon after they are born, a few weeks, a few months, you see a whitish discoloration inside the eye, like a cataract.
Oh, okay.
But they are too young to have a cataract. That's a sign of a cancer. So or even maybe sometimes the child will suddenly have altered vision, or will not suddenly not be able to see things very well and all that. That's the point that it could be a cancer. Sometimes they are constantly tired all the time. They are not very active.
Because children are supposed to be active. So when there's tiredness, it's a cause to worry.
Consistently tired all the time. Yes, then you should be investigating the child. Sometimes they have these fevers and then drenching night sweat. So they sweat so much that when they wake up in the morning, the bed sheets, everything is wet. Yes, so those are all signs that should tell you to go to the hospital and
get your child checked.
Okay.
Yeah. So can you take us briefly through the diagnosis process?
Okay, so with the diagnosis, it depends on what the child is presenting with. But normally, sometimes just the full blood count alone can give you an idea. So once the child comes with this and this symptoms, just a normal full blood count will point that no, this looks like it's a blood cancer. There's too much of these cells or too few of these cells. You can easily tell. Sometimes you need to do ultrasound scan. The bone tumors, you might do X-ray
and all
CT scans and all those other things. So it's not really anything really extraordinary you do, but is it things that would show.
Does it take a long time for you to reach a diagnosis?
With childhood cancers, usually no.
Okay, it's pretty simple, straightforward.
So unless you have a lazy health professional who doesn't want to look at other, so some people will say, oh, it's malaria. Don't even test anything.
Okay.
They'll say, oh, it's malaria, and then you go and then 3 times in the same month they are still
treating
saying
malaria.
Then you should know you shouldn't trust that person. The person should always ask you to be doing tests. If he tells you this and you've treated and it's not going, at least do
something else.
Do further tests and investigate and try and find out. Don't say you don't have money so you won't do the lab test, because that could be the difference between identifying a cancer early or not.
I know you've mentioned that these childhood cancers are treatable. Are they totally treatable? And then also, like, I know you've mentioned there are different types of cancer, so obviously it will depend on the type of cancer and then the treatment.
Exactly.
But is it totally treatable? And then after treatment, what is the life expectancy? Do we expect that maybe in some 10-15 years the cancer is going to resurface, or when you are done, you can assure that, oh, this cancer is not going to come back?
Okay. So generally, we think of it in terms of comparing it to the way we see the pattern of cancers in adults. Okay. So generally, if you are looking at its overall numbers, there's 80% survival rates within the first 5 years. Okay, which is much higher than most adult cancers.
Yeah.
Yes. And when you talk about the cancer resurfacing after remission, something like leukemias, in an adult, there's a 50% chance that it would come back within the first 2 to 3 years. In a child, there's like a 10-15% chance that it will come back. So when you look at those numbers, it's better, it's a higher rate of success for children. But when you want to look at it on a specific basis, it depends on the stage at which you identified the cancer and started treating it. Because if it's far advanced before you start treating it, then the prognosis afterwards is not very good. But if you talk about how they would live their life into adulthood, because of sometimes the effects of the cancer itself or the cancer treatment, maybe radiation therapy, chemotherapy, they might be at risk of developing maybe hypertension.
I was going to ask that
earlier on. So maybe if in their family, maybe you develop those diseases maybe around age 65, thereabouts. Maybe they might develop it around age 45, those kind of things. But it's not that they won't be able to have a fulfilling life or their life is totally ruined after they get cancer. Once they are treated, they should be able to live quite healthily.
Normal lives.
Yeah.
But then I was just going to ask what side effects these treatments come with. So I'm glad you've mentioned the hypertension and all that. So I want to find out, is there a way we can sort of mitigate the risk of somebody who has survived a childhood cancer getting some of these diseases earlier than expected?
Okay, yes. So, well, with that, a lot of these diseases are lifestyle diseases. Okay, so as in, you can actually affect them by the way you live. So the food you eat, your behaviors,
staying healthy,
yes. So exercising and all those things all plays a role in preventing you from developing these diseases. So when we look at those numbers, we are looking at it in terms of the general population, and if they live the way let's say those ahead of them have lived, how they would develop those illnesses. But of course, you can mitigate it through your choices and your healthy lifestyle, avoiding smoking and drinking as usual, and then just eating healthy, exercising, making good choices about how you want to engage in things. Don't go and use drugs and those kind of things like that. You should be able to live quite healthy, quite long life. But the treatments themselves, in the short term, they have some side effects. Some of the treatments, especially for the Burkitt's lymphoma, those are the ones that I have seen personally. And they get very, very fatigued, and it's like it takes a lot of energy out of them.
And they are children.
Yes, so during the treatment, you see them very weak and all that. So sometimes the parents get worried. But don't be worried, because we are actually in the process of
making your child better.
Yes. So that's one of the things. Sometimes the normal vomiting, loss of hair, all those things.
The children also go through that.
Yes, depending on the type of chemotherapy they are using. And there's something we call tumor lysis syndrome. So especially in the kids where the tumors are growing very rapidly, when you are using the chemotherapy, you are killing off these cells also very rapidly. Yes, so it's causing a lot of, should I say, debris of the dead abnormal cells. So that debris can also be toxic to the body, can affect the
So how does it come out?
So it's just a lot of hydration, hydration, so that it doesn't like choke up. It's like a lot of solid dirt passing through a tube. It's like a drainage system. So you have to just keep diluting. So make sure they just have a lot of fluids and all that during the time of treatment, so that they don't develop that.
So it will come out through the urine and then the feces as well, or basically
usually through the urine. Yeah. So it's just keep them well hydrated and all that. If they are not, then the debris can also now affect their healthy organs and then cause more problems.
Okay. Yes. So finally, we want to look at any resources or organizations that are available, providing emotional support and then guidance, both for the child going through this. Because obviously, I know the child would see that my friends, I'm a bit different from my friends.
Yeah.
So for the child who is going through this cancer, and also for the family, primarily the parents, and then if there are any siblings.
Yes. So it's what we call a multidisciplinary approach.
Okay.
So when the child has a cancer, we have the nutritionist or dietitian also on board, psychologist on board, pediatrician, oncologists, depending on the type, surgeon, sometimes if they need surgery.
That's a whole team.
Yes, so they have a whole team. So once you have been diagnosed of a childhood cancer and you are on admission, you are exposed to all those people. There are lots of actually smaller groups that are doing a lot of advocacy here and there.
It's unfortunate I don't remember the name of the ladies. Is it Viva Texan Foundation or something?
Yeah. So, but there's one it's called the Childhood Cancer Society of Ghana. Yeah, they are online. They have more of an online presence and all that. They have a lot of stuff, educational stuff, and they also do a lot of things. Usually, once you are in the hospital and you are seeing the oncologist, all that information is actually available. It's not like general available everywhere.
But once you are in it, you find it.
Yes, you will find it. So the issue is, if you are in it, how to identify it early enough so that you can get the best treatment and then the best prognosis.
Okay. Time is up, but I forgot to ask, is there a way of preventing? I know you mentioned that it has something to do with genetics and all that, but is there a way that you can prevent childhood cancers?
Unfortunately, no, because we don't really understand how they come about in the first place.
Okay.
We only know like when it has come, how to identify it.
Okay.
But we can't really tell how before we can prevent it for now. So
Unless
hopefully
prayers.
the scientists are doing
Maybe
their
prayers.
work. Maybe prayers, yeah.
Thank you so much, Dr. Emefa. It was a very insightful conversation.
You're welcome.
Thank you for always making time for us.